So we've had a site here in Rapid City since 1989, and SDSU is a land-grant institution. We feel a real responsibility to meet the nursing workforce needs across the state, and Rapid City is part of that answer. I think one of the major benefits here is that we are the only bachelor's prepared program in Western South Dakota. Our strong collaboration with Black Hills State University and our clinical partners in the area set us apart.
So students that are local have options for BSN Standard Program, which is a 4-year degree, and then BSN Accelerated Program, which really just takes 12 months, but it's still the equivalency of that 4-year degree. We also offer master's programming, and that is online, so a student who's local could take that, and they may have their instructors living local that are teaching online. And then the DMP program is also available to students in this area.
We were pretty intentional about thinking future forward in regard to emerging technology needs, how we can immerse students in simulated activities that really provide opportunities to experience things they may never see while they're in nursing school.
We have several debrief rooms. That's where students will come initially before their simulation experience. They'll get their pre-brief in that space. If they are a observer, that will be watching the simulation unfold. And then after the end of the simulation, they'll all come into the debrief space as well, where we have those conversations. How did it go? How do you feel? We have capabilities of performing simulation in a hospital setting. We also have several clinic rooms, so students can get the experience of the clinic rooms as well. We have a home health room, so students can get the experience of going into patients' homes. We have a PRISM room, it's WorldViz PRISM room. It's gonna add a lot more diversity and complexity to some of our simulation experiences for our students. And then we have a lab space, which simulates that acute setting. We have the flexibility of running large simulations in there, but we also run our labs in there as well. So multiple students can be in the space at one time and practice on our mannequins and get that hands-on component.
In addition, I think our Native American Nursing Education Center and the support for those students sets us apart. We have intentional mentorship for those students to help them be successful. More than 90% retention rate. All of those graduates have gone on to pass boards, and now they're providing care for people in their communities, whether it's in Rapid City or in their tribal communities. We really think that that's an important piece, and we have an obligation to meet that need as well.
As the only nursing program in the area that offers a BSN, we really are adding something to the staffing across the region. Providing more and more BSN nurses supports care, supports access to care. Many of our students attend in Rapid City with the goal of returning to a rural community, or now we have students who are studying in a rural community and are able to earn that degree online. And so every time that we can have a student graduate, that is one nurse who will potentially take care of thousands of patients. If you have any desire to be a nurse, this is the place to come. We are just waiting for you.